There is something in the air this time of year. You probably started hearing all of our coworkers coughing and sneezing a little bit more recently.
Yep, one particular virus is making headlines across the United States right now. Respiratory Syncytial Virus. It's a respiratory sickness, otherwise known as RSV, and it's typically found in really young children. Abby Davis joins us now. And Abby, the Centers for Disease Control confirmed RSV cases are surging across the country, but what are we seeing here in Idaho?
The doctor I spoke with says they're seeing an early respiratory virus season, but as far as RSV specifically goes, we actually have fewer cases right now than we did at this time last year.
The last few years, all bets are off.
Kenny Bramwell, St. Luke's Children's Hospital medical director, says they're seeing more kids sick with respiratory illnesses in October than usual. The CDC says one virus in particular, Respiratory Syncytial Virus, or RSV, is spreading among young kids in different areas across the country.
It seems to be a really potent strain and is affecting the small infants perhaps more than other years.
But Bramwell says that's not necessarily the case in Idaho.
I don't know that we're seeing anything that is dramatically different with any one virus, other than they're all coming.
RSV is typically seen in infants and toddlers.
One of the problems that happens with RSV, particularly with young infants, is their nasal passages get completely swollen shut. So if they have totally congested nose openings, they can't breathe, and they cry, and they tend not to stay very well hydrated, and they tend to get sort of tired just because of how congested their nasal passages are.
In Idaho, Bramwell says the number of kids sick with RSV is actually down from last year.
The Department of Health is still tracking RSV cases, and we've had a few, but the season hasn't officially started. So they're monitoring things, but they haven't seen enough cases for us to say, okay, it's RSV season.
Idaho Department of Health and Welfare data posted last Friday shows 470 RSV tests in Public Health District 4, which includes Ada, Elmore, Boise, and Valley counties. Of those 470 tests, just 14, or 3%, came back positive. Take a look at this graph from the Department of Health and Welfare. This dark blue line is a lot higher than this light green line, and that's because this dark blue line represents the number of RSV cases we had last year. The light green line is the amount of RSV cases we have this year. So you can see just how many more cases we had last year.
Everything got changed during COVID because then those infants who didn't get exposed to RSV got it the next year. So we had a particularly big year once everyone stopped wearing masks.
Bramwell told me RSV is a big reason that children's hospitals run out of beds every year. St. Luke's has about 100 beds in its children's hospital. And remember, it's the only hospital in the valley that admits children. Now, Bramwell didn't give me a specific number about how full they are right now, but says that they're doing okay for space. And of course, that can change depending on staffing or the severity of a child's illness, in which case they would start transferring kids to other hospitals.
It is interesting to see that anomaly of last year, how much that spiked because of the mask wearing.
Flu too.
Yep, exactly. All right. Thanks, Abby.